Hello everyone. Today I am going to present my case study video on mitral stenosis. Introduction. Mitral valve, also known as the bicuspid valve or left atrioventricular valve, is one of the four heart valves. It has two cusps or flaps and lies between the left atrium and left ventricle of the heart. Consists of fibrous annulus, anterior and posterior leaflets, papillary muscles. Case scenario: a 35-year-old lady complained of progressive external shortness of breath in the past 2 years. Physical examination revelated a loud first heart sound, an opening snap, and a mid diastolic rumbling murmur with an irregular pulse. Definition: Mitral stenosis. Mitral stenosis is a disorder of the mitral valve which involves a blockage of blood flow due to abnormalities of the mitral valve leaflets. Causes: infective endocarditis, calcification of the valve leaflets, rheumatoid arthritis, lupus erythematosus. Risk factors: acute rheumatic fever, infective endocarditis, beta hemolytic streptococcal infections. Assessment: mitral valve is also known as.
Bicuspid wall,
What is mitral stenosis?
narrowing or blockage of wall,
Causes of mitral stenosis.
calcification and rheumatic heart disease.
Thank you. Pathophysiology: in mitral stenosis, the valves become classified and restricted in movement. There is a narrowing of the valvular orifice, preventing normal blood flow from left atrium to ventricle. The valve orifice is normally 4 to 6 cm. With mild stenosis, it is reduced to 2 cm. This results in an increase in pressure required and generated to facilitate blood flow from left atrium to left ventricle. A critical mitral stenosis valve opening is reduced to 1 cm. The obstruction creates a pressure gradient of 20 mmHg, arising atrial pressures to 25 mmHg. This in turn increases pulmonary and venous capillary pressures. The left atrium hypertrophies and the right ventricle hypertrophies because of chronic pulmonary hypertension, from which right ventricular failure can result. Clinical manifestation: diastolic rumbling, loud snapping as one heard using diaphragm of stethoscope, fatigue, palpitations, narrowed pulse pressure, hoarseness, left ventricular failure, right ventricular failure. Diagnosis: chest radiographic film, ECG or echo. Treatment: pharmacological management, diuretics to reduce fluid accumulation, blood thinners to help prevent blood clots. A daily aspirin may be included. Beta blockers or calcium channel blockers to slow the heart rate. Antiarrhythmic to treat atrial fibrillation. Treatment: surgical treatment, mitral valve replacement, balloon valvulotomy, mitral valve replacement. Assessment: what are the symptoms of mitral stenosis?
Diastolic rumbling, fatigue, and palpitation.
How is mitral stenosis diagnosed?
Chest X ray, ECG, and echo.
Name some surgical treatments for mitral stenosis.
Mitral valve repair and mitral valve replacement.
Thank you. Reference: Book of Cardiothoracic Surgery, Medical Surgical Techniques. Thank you.